Yes, I think in the first place, one has to realize that the southern part of the country, or southern Africa, is one of the areas that has been hit hard by the HIV and AIDS pandemic.
Well, we start working with the Clinton Foundation, and Clinton Foundations. We start with the cooperations. Okay, Heifer is working to inform the community where Heifer serving, to let people know that what the dangers of HIV and how the methodology to prevent it. If they encounter the problem, where they can go, and Clinton Foundation just stay aside.
If we're talking about AIDS, I won't be that sure and precise about the statistics, but I know that the statistics are pretty bad about the situation with AIDS in Russia and how we could help in the rural areas, especially where people are not that educated.
The people getting AIDS is increasing every year, maybe double. It's far away the expectation of the government. The government would like to have a very big program to prevent the spreading of that disease and to reduce the effect on the population in general.
We are going to work in nutrition and income. We are going to support the families which suffers with AIDS.
By giving animals to poor families, especially small animals, you can help them to have a better nutrition and also increase their income.
When we distribute, for example, rabbits, the idea is, one, the rabbit meat is said to be highly nutritious. It assists the body immune system in getting boosted. And therefore the person, obviously, when their immune system is boosted, they can live longer.
So, but in our project, mostly focus on helping them to improve livelihood and working together and increase the awareness about the HIV/AIDS. Also avoid the drug taking and how to prevent the HIV/AIDS.
Currently with HIV/AIDS, apart from awareness creation, but the big project we are concentrating on helping widow and orphan and people living with HIV/AIDS.
We are, we've improved our strategy. One, we have gone beyond sensitizing people and ensuring that people that are aware and sensitized, carry out what we call voluntary counseling and testing, so that they know their HIV/AIDS status. And what we have seen has been very encouraging, because once they know their HIV/AIDS status, they become very responsible in the way they conduct their lives.
The first one, we train the volunteer at the communities to provide care and consolation for the patients and the family members, so that we send the volunteer twice a month to go to visit the families of the patient and provide consolation to reduce the stigma and also reduce the discrimination among the family members and among the community's members.
We have now a number of projects, 4 of them, where we are targeting both the HIV/AIDS infected but also those that are affected.
Initially, we had proposed to place 170 heifers, starting with 85, and then cover the other 85 with persons. But fortunately for the group, we received cows from Boha, like I told you. We have already covered the rest of the 85 that we wanted to cover through POGs.
In the past, when the HIV/AIDS patients, they require something from government and the local government agencies. They said, "Oh no, you are not longer to alive. you are not qualified for this kind of loan, this kind of things. You are not longer alive, and that's so sad for them. But however, after they get training from Heifer time by time, Heifer Cornerstone, they know that they value, and they started a small program, and they did a really good job. Up to now, some of them will become to be they elected to be the leaders among the community. So,
but what we have realized is that we have some challenges. We cannot run these projects as our normal project because the requirements and needs of these people are different. So we are now thinking to re-strategize as to how to support these people better. Maybe we need to partner with more organizations who have the resources or the capacity to help us support these vulnerable people.
We also train the communities how to avoid or prevent the HIV/AIDS, because at this point I think prevention is very much relevant to Indonesia before it getting worse.
The next step at the moment is to begin looking at the other area programs where we've been seeing statistics of HIV/AIDS impact to be high, so that we engage with the area programs at HQ here to see if we can link up with the country programs to work with them to carry out a kind of study to see the impact of HIV/AIDS on the families that we are working with, so that we can jointly come up with strategies on how to come up with programs or initiatives to mitigate the impact of HIV/AIDS on these families, as well as prevent some of the groups that are vulnerable and are most likely to be impacted by HIV/AIDS in the future.